Just as Dr. Harper dismisses an uninsured patient, unaware of his true identity, an unexpected visitor arrives at the hospital. None other than the CEO and major benefactor, Richard Douglas, who is furious. He reveals that the patient is his estranged brother, Thomas, and demands an explanation for the doctor's heartless decision. The revelation leaves Dr. Harper stunned, realizing the severe consequences of his actions. Richard's drastic response threatens not only Dr. Harper's reputation but the future of the entire hospital. The twist that follows will make everyone rethink their values and priorities. But before we dive in, leave a comment and let us know where you are watching from today. And if this story speaks to you, hit that subscribe button for more amazing stories. In the bustling halls of St. Mary's Hospital, Dr. Stephen Harper, a respected surgeon in his mid-40s, moved swiftly through the corridors. His white coat flowed behind him as he glanced at his clipboard, mentally preparing for his next case. Stephen had built a reputation for himself, a brilliant surgeon with a no-nonsense attitude. But with that brilliance came an arrogance that was hard to ignore. He entered the emergency room, where nurses and junior doctors were rushing around, attending to patients. The place was chaotic, filled with the cries of the injured and the frantic voices of families. Stephen spotted Nurse Miller, a woman in her early 50s with a kind face, approaching him with a worried expression. "Dr. Harper, there's a patient in exam room 3, she began, her voice filled with concern. "He's in a lot of pain, but there's an issue with his insurance," the clerk said. Stephen held up his hand, cutting her off. "No insurance, no treatment, Nurse Miller. You know the rules. We're not running a charity here." Nurse Miller hesitated, her lips pressing together in frustration. "But Dr. Harper, he's in severe pain. He needs help." Stephen sighed, his eyes narrowing slightly. "I'm sure there's another hospital he can go to. We have protocols, nurse. If the patient can't provide valid insurance information, then we can't do anything for him." Nurse Miller's eyes flashed with something between anger and disbelief, but she knew better than to argue. She nodded curtly and turned away, heading back towards exam room 3. Inside exam room 3, a man lay on the examination table, his face pale and twisted in pain. He was dressed in simple clothing, a faded t-shirt and jeans, and his breathing was labored. His name was Thomas, and though his appearance was unassuming, there was an air of quiet dignity about him. When Nurse Miller returned, her heart ached at the sight of him. She approached the bed, placing a gentle hand on his arm. "Mr. Thomas, I'm so sorry, but Dr. Harper said, without valid insurance, we can't proceed with treatment here." Thomas winced, his eyes opening to meet hers. There was a flicker of understanding in his gaze, but also a sadness that went beyond the physical pain. He nodded slowly, his voice weak as he spoke. "I understand. Thank you for trying." Nurse Miller's throat tightened. She hated this part of her job, the bureaucracy that got in the way of helping people who truly needed it. She wanted to do more for Thomas, but her hands were tied. "Is there anyone we can call?" she asked softly. Thomas shook his head. No one." Nurse Miller hesitated for a moment before giving his hand a comforting squeeze. "I'll see what I can do," she promised, though she knew it was a hollow vow. As she left the room, Thomas closed his eyes, trying to steady his breathing. He knew he needed medical attention. His condition was worsening, and the pain was becoming unbearable. But he also knew that the system didn't care about people like him. People without insurance, without the means to pay. Later that afternoon, Dr. Harper was in his office, reviewing a patient's chart when there was a knock on the door. He looked up, annoyed at the interruption. "Come in." The door opened, and in walked a man in his early 60s, dressed in an expensive suit. He carried himself with authority, and his eyes, though kind, held a sharpness that commanded attention. Stephen stood, his eyes narrowing. "Mr. Douglas, this is unexpected." He recognized the man instantly, Richard Douglas, one of the major benefactors of St. Mary's Hospital, a man whose donations had kept the hospital afloat for years. Richard nodded, his expression serious. "Dr. Harper, I need to speak with you about a patient. A man named Thomas." Stephen's brow furrowed. "Thomas? I'm not familiar." "He was in your ER this morning," Richard interrupted. his tone leaving no room for argument. He needed treatment, but was turned away because of an insurance issue. Stephen's annoyance turned to defensiveness. "Mr. Douglas, we have policies in place for a reason. If a patient doesn't have insurance, we can't." Richard held up his hand, his eyes flashing with anger. "Thomas is my brother, Dr. Harper." Stephen felt the blood drain from his face. "Your brother," he stammered, his mind reeling. How could this be? The man in exam room 3 had looked so unassuming, so ordinary. There had been nothing to indicate that he was related to one of the most powerful men in the city. "Yes," Richard said, his voice tight. "My brother. He's had a difficult time, but that doesn't make him any less deserving of care. I trusted this hospital to help those in need, not to turn them away based on their ability to pay." Stephen opened his mouth to respond, but no words came out. He could see the fury in Richard's eyes, the disappointment that cut deeper than any reprimand. This was not just about a policy. This was about a man's life, a man who had been denied help because of Stephen's own arrogance. Richard stepped closer, his voice low and dangerous. "You turned away my brother when he needed help the most. Because of you, he's now in another hospital, in critical condition." Stephen's heart pounded in his chest. He had made a mistake, a grave mistake, and now the consequences were becoming clear. "Mr. Douglas, I had no idea," he stammered, his usual confidence shattered. "If I had known." "But you didn't bother to know," Richard cut him off, his voice cold. "You didn't care to ask, to find out more about the man lying in that bed. All you saw was a lack of insurance, and you made a decision based on that." Stephen felt a knot form in his stomach. He had prided himself on his efficiency, his ability to make quick decisions. But now, faced with the reality of what his actions had caused, he realized just how wrong he had been. Richard took a step back, his eyes never leaving Stephen's. "I'm pulling my funding from this hospital, effective immediately. I will not support an institution that refuses to treat those in need." Stephen's eyes widened in shock. "Mr. Douglas, please." "It's done, Dr. Harper," Richard said, his voice final. "I suggest you take a long, hard look at the kind of doctor you've become." With that, Richard turned and walked out of the office, leaving Stephen standing there, his heart pounding, his mind racing. The weight of what had just happened settled over him like a heavy blanket, suffocating and inescapable. The next day, the news spread like wildfire throughout the hospital. Richard Douglas, the hospital's largest benefactor, had pulled his funding. The atmosphere was tense, the staff whispering in hushed tones about what this meant for the future of St. Mary's. Stephen walked through the halls, his head down, his usual arrogance nowhere to be seen. He could feel the eyes of his colleagues on him, their judgment clear. He had made a mistake, one that had cost the hospital dearly, and one that he would have to live with for the rest of his career. He found himself standing outside exam room 3, the room where Thomas had been just a day earlier. The room was empty now, the bed neatly made, the monitors silent. Stephen stepped inside, his heart heavy as he looked around. He thought about Thomas, about the pain in his eyes, the quiet dignity with which he had accepted his fate. Stephen had been so focused on protocols, on the bottom line, that he had forgotten the very reason he had become a doctor in the first place, to help people. He closed his eyes, a deep sense of regret washing over him. He had failed Thomas, and in doing so, he had failed himself. A week later, Stephen stood outside a small hospital on the other side of town. He had spent the past few days trying to find out where Thomas had been taken, and when he finally did, he knew he had to come. He walked through the doors, his heart pounding as he approached the nurse's station. "I'm here to see Thomas Douglas," he said, his voice steady. The nurse nodded, gesturing down the hallway. "Room 207. Stephen made his way down the hall, his footsteps echoing in the quiet. He stopped outside room 207, taking a deep breath before pushing the door open. Thomas lay in the bed, his face still pale, but there was a hint of color returning to his cheeks. He looked up as Stephen entered, his eyes widening in surprise. "Dr. Harper," he said, his voice weak. Stephen stepped closer, his heart heavy with regret. "Mr. Douglas, I came to apologize. I made a terrible mistake, and I'm so sorry for what I put you through." Thomas studied him for a moment before nodding slowly. "Thank you," he said, his voice soft. "It means a lot that you came." Stephen pulled up a chair, sitting beside the bed. "If it's okay with you, I'd like to help with your care from now on. No insurance, no payment. Just me, doing what I should have done in the first place." Thomas's eyes glistened with emotion, and he nodded. "I'd like that, Dr. Harper." Stephen smiled, a small, genuine smile, the first he had felt in days. He knew he couldn't undo the past, but he could try to make things right, one step at a time. And maybe, just maybe, he could become the kind of doctor he had always aspired to be, the kind of doctor who saw people, not policies.